So this I made to help you get the nursing process and the concept map, because there seems to be a break, a lack of there's a disconnect there, lack of connection, a disconnect there. So we're going to go more into the nursing process and relate it directly to your concept map. So what is nursing concept map? It's a visual tool to organize your assessment data, identify the patient problem, determine appropriate nursing diagnosis, determine appropriate nursing interventions for your plan for each identified problem, and evaluate the effectiveness or response to each intervention. If you notice that, that's your ADPI: assess, diagnose, plan, intervene, evaluate. With your concept map, I have intervention and plan in here because your goals, what you hope your outcomes are, you don't write what you're hoping for, but you put it in what you achieve at the end, which will make sense as I go through. Your outcomes evaluations are in the same box, so I kind of blended them to help you. So, on your actual concept map, page 2 of your concept map in your clinical manuals, you will see on there that you have your history, risk factors, objective and subjective data, medications, lab data. Oh, I didn't put medications on here, sorry. Diagnostic procedures and surgical interventions. That's on page 2. So when we're looking at our API, nursing process, your assessment includes that. Your past medical history and risks that history gives that person. That's why I put those together. It's part of your assessment. Then you're going to do your examination, which you have done prior to writing your concept map. You have all those pages of the physical examination you did, which is a lot of your objective data. And then you're looking at your laboratory data here. Medications, I probably should have put here with your history, because that's part of what you've gathered as part of your assessment, is what medications they're on. Subjective data is what the patient's saying to you. I'm hurting, I'm in pain, I'm short of breath, I feel weak, I'm scared, I don't know about this. They're subjective data. Diagnostic tests are any of your diagnostic procedures, surgical interventions that they had done, all go on page 2. This is all part of your assessment when you're looking at your patient here. So your history includes your risk, and I said should be medications. Your examination is your objective data that you've already collected, all their vital signs, their physical assessment, and their laboratory data, possibly your diagnostic tests and interventions, your diagnostic and your subjective data. Yeah, keep going. Okay, so nursing diagnosis, still go back to page 1 of your concept map from your clinical manual. So on there, you have a medical diagnosis. The alterations in health diagnosis, that's your medical diagnosis. Why are they in the hospital? What was their reason for admission? Why are they getting medical care? That should be 4. Sorry, that's a typo on my part. So they're in because of new diagnosis of diabetes. They're in there because of pneumonia. They're in there because of a broken hip, something like that. Then that arrow on your concept map goes over to client problem related to alteration in health. So this alteration in health is what sent them into the hospital, the nursing home, the rehab, the home health, the clinic, whatever your work setting is, has sent them in that alteration or health. So you as a nurse, what is your client's problem that's impacting their health or the wellness? How does this relate to the medical or wellness issue? And what is it evidenced by? So you're looking at this patient that came in with, we're going to go with pneumonia, and I'm going to break it up as we go along. But so you have your medical diagnosis of pneumonia, your nursing diagnosis, client problem impacting health and wellness would be what? A fever? No, it would be difficulty in breathing, alteration in gas exchange, inability to take care of themselves because well, it would be like a shortness of breath. And how does this relate to the medical or wellness issue, and how is it evidenced? So alteration in breathing pattern related to, if it's pneumonia, inflammation in their lungs or thick mucus in their lungs. There's an impaired gas exchange due to mucus in the lungs, as evidenced by, could be coughing up thick mucus, inability to clear airway, something like that. So on your concept map on page 1, that's why you have your alteration in health or their medical diagnosis, what brought them to wherever you're caring for them. Then you have your client problem related to alteration in health, which is your nursing diagnosis. And it needs to be something nursing can do something about within the scope of a nurse. Your pathophysiology related to that client problem is there because you need your patho to figure out how does this problem cause this in the body, as evidenced by what is your medical information. So that's why on your concept map you have your pathophysiology that is related to specifically to the problem you're talking about, not every problem they have going on. So again, if we're focusing on pneumonia, the pathophysiology related to pneumonia, which is in your oxygenation sections of your Pearson. And on also, when you're doing your concept maps, remember to be looking at your grading criteria, which is in your manual. Right behind your concept map, you have clinical grading. And when it talks, your concept map, alteration in health, 1 point, client problem, 1 point, pathophysiology, 1 point. Assessment has your past medical history, risk factors, objective, subjective, medications, all those things that were on page 2. Continuing on with nursing diagnosis. It tells you on your grading, on your nursing diagnosis, you have to have a minimum of 2 nursing diagnoses related to the admission or why they're in the hospital, what you have found. Okay, so the purpose of a nursing diagnosis is to identify the nursing priorities. Now, your nursing diagnosis, you can come up with all kinds of things, but what is your priority? Most important 2 things you need to do for this patient to improve their health outcomes. And do it within your scope of practice, within the time frame you are with them. So your goal isn't that they're going to be discharged unless they're being discharged the day you're there. And you don't have say-so over their discharge. So it might be some of the teaching they're going to need before they go home. That was something nursing has a power over to do interventions to teach. So identify nursing priorities and help direct nursing interventions based on identified priorities. Because if you don't set a priority diagnosis, if you don't look and go, this is a major problem, they can't get anything done because they cannot clear their airway. So your priority is to do interventions that are going to clear their airway. So your plan is to improve their airway clearance, and then your interventions would be things that would improve that airway clearance, and then your outcomes that you hope to achieve would be that they have improved, as evidenced by like coughing up a lot of stuff, saying they're less short of breath, being able to walk 10 feet where before it was only 5 feet. So it helps you formulate your expected outcomes. There's different types: problem-focused, health promotion and risk, Problem-focused, you need to have a problem-focused nursing diagnosis. Have to have a problem-focused. So impaired mobility related to left-sided paralysis. So somebody came in, their mission diagnosis is they've had a CVA, cardiovascular accident, a stroke. So your nursing problem that you see is impaired mobility related to left-sided paralysis as evidenced by inability to move the left side of their body, inability to lift their comb, inability to get out on the left side of the bed as evidenced by something. And then your other diagnosis can be a health promotion or a risk. Because they have this impaired mobility, they have a risk for falls. Because they've had a stroke, it may be related to the fact they have a sedentary lifestyle, and that's something you can do teaching on. So pick one problem-focused and one health promotion or risk. Some other problem-focused might be sleep deprivation related to pain, or decreased cardiac output related to a myocardial infarction. Okay, so example. I decided to break one up here on pneumonia. Nursing diagnosis example. Admitting medical diagnosis is pneumonia. The most significant assessment finding you find is their shortness of breath. So your nursing priority health need is alteration in gas exchange. What is causing this problem? That's the pathophysiology. It's related to inflammatory process in lungs. How do you know? Oh, I left out do, sorry. How do you know? As evidenced by shortness of breath with activity. So how would you write this nursing diagnosis on your concept map under client problem related to alteration in health? You would write alteration in gas exchange related to inflammatory process in lungs as evidenced by shortness of breath with activity. That's your nursing diagnosis. So you look at your concept map, page 1, do alterations in health diagnosis, that's their admitting diagnosis. On the right-hand side, your pathophysiology. Combine those, you see your priority problem, and you write your nursing diagnosis in the middle. Plan for interventions. So here, I blended, when you plan, you have to have a goal, you have to have an outcome in mind. So here I put first step is setting the priority interventions to improve the specific health issue being addressed in the stated nursing diagnosis problem. Use evidence-based practice guidelines. Look in your textbook for issue or body systems, the concept area. An example is oxygenation. That's where you'll find pneumonia, and choose proven measures or interventions. The grading on the concept map states a minimum of 3 interventions per problem or nursing diagnosis. So you're going to have 2 nursing diagnoses. It means you're going to have 6 interventions. 1 problem-focused problem, 1 risk or health promotion problem. Always teach, educate the patient. This is a specific box on your concept map. So if you look did page 1, did page 2, we get to page 3 of your concept map, and you have nursing interventions, client education, outcomes evaluation. So here, if you're thinking of the nursing process, your outcomes is what your goals would be. So you write your goal and was it effective, kind of blended in one thing. So when you know what you hope to achieve with this person who's been so short of breath, you're hoping that they can learn to space out their activity. An intervention may be breaking up their activities, breaking up things that need to get done, so you're not waking them up all the time, breaking it in small pieces so they don't get short of breath, so that they can heal. So get to hear your evaluation, your outcomes, which listed in page 3 of your concept map. Begin with the end goal in mind. You've identified a health problem. You plan interventions to improve or resolve the health problem. Did it work? Completely? Partially? Not at all? They must be SMART, specific, measurable, achievable, relevant, time-based. It's also on that other recording. So your specific, measurable, achievable, relevant, time-based. Your specific thing is they're able to walk 5 feet. That's measurable, and it is specific. Walk 5 feet. Walk with a walker 5 feet. Is it achievable? Are they going from none, or because they don't want to put, they're going to be able to walk 100 feet, they're going to walk all the way down the hallway when they've not even gotten out of bed. So maybe for your shift, your goal may be that they're able to get out of the bed to the chair, and it can't be minimal assist, because how do you measure minimal assist? Assist of one person, assist of 2 people, assist, standby assist only is measurable. Is it achievable? Is it relevant to the problem? So if your diagnosis is impaired skin integrity due to a decubitus ulcer related to immobility, a not relevant goal for that would be that they ate all their food. You may be thinking, okay, we need to increase their protein, their intake, to help with their healing, but that's not related to that specific problem. That specific problem you said is related to their immobility. So your goals specific for need to address immobility. If you're addressing their oxygen, shortness of breath, and you'll need the mucus to clear, your interventions and goals need to address the mucus, not everything else that could be going on with that person. Make it specific to the one thing. Get tunnel vision on these. Not tunnel vision taking care of your patient, but tunnel vision when you're planning for a specific problem. Safety considerations. That's on your last page of your concept map, because safety, 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 safety. So safety considerations. Relate the safety to your priority health concerns. So you've come in with 2 priority nursing diagnoses, 2 priority nursing things. So relate your safety considerations to that. It can be related to so many things: medication, equipment, fall prevention, teaching, understanding, family teaching, patient teaching, self-care, wound care, but make it the safety considerations that they're able to do the wound care using aseptic technique. That even is this a safety consideration, or is this somebody that would not be safe for them to do their own wound care? So you're looking at a safety consideration is trying to get a consult for home health care because they're not going to be able to do it, or the family member, caregiver is not going to be able to do it. Those can be your safety considerations. Your medications, are they new on a medication? Do they have dementia? Is it going to be safe for them to take it? Will they understand if they're on something for diabetes? Is it going to cause hypoglycemia? Are they on a new hypertensive drug and they have to slowly, or diuretic that might cause hypotension with position changes? So is that a risk for falls? Those are your safety things. So hopefully this has rounded it out for you and helped it make a little more sense. And that is the end of this recording.